Diabetes management goes beyond just blood sugar control, it's about protecting your nerves, energy, and overall health. Discover the 4 essential vitamins that can help lower blood sugar, repair nerve damage, and boost vitality. Stay tuned for science-backed solutions to support your journey. You've spent decades managing diabetes, but have you ever wondered how well you're truly supporting your body? From nerve pain to fatigue, diabetes can take a toll. In this video, we'll explore 4 powerful vitamins that can help protect your nerves, improve blood sugar control, and give you the energy you deserve. Let's take the first step toward a healthier tomorrow. Are you looking for ways to support your health and manage diabetes better? It's all about the right nutrients. In this video, we're diving into 4 powerful vitamins that can make a real difference in your blood sugar control, energy, and nerve health. Stick around to find out which ones you might be missing and how they can help you feel your best every day. Let's begin with number 1. Benfotiamine is a special form of vitamin B1. It's made to be fat-soluble, which means it can enter cells more easily than the regular water-soluble form of B1, called thiamine. In people with diabetes, high blood sugar can damage nerves, eyes, and kidneys over time. This happens because too much sugar in the blood leads to harmful byproducts that build up in the body. These byproducts can harm cells and blood vessels, especially in areas with lots of small blood vessels like the fingers, toes, eyes, and kidneys. When you take benfotiamine, it helps move extra sugar through a safer chemical pathway in your body called the pentose phosphate pathway. This means less sugar goes down the harmful paths that create things like AGEs, advanced glycation end products, which are sticky molecules that form when sugar attaches to proteins. AGEs make tissues stiff and inflamed and are one of the main causes of nerve pain, slow wound healing, and organ damage in people with diabetes. Benfotiamine has been tested in several clinical trials. In one study, 600 mg per day was given to people with diabetic neuropathy for 6 weeks. Most of them felt less pain, burning, and numbness. Another study showed that benfotiamine helped improve nerve signal speed in the legs, meaning the nerves were working better. Some people started feeling better after only 2 weeks. In longer studies lasting 3 to 6 months, patients showed better blood flow in the feet and hands, and their nerves responded more quickly to touch and heat. Compared to regular thiamine, benfotiamine gets absorbed better in the intestines. When people take 100 mg of thiamine, only a small amount gets into the blood, and even less reaches the nerves. But with benfotiamine, blood levels of thiamine go up much higher, some studies say 5 to 25 times more. This makes it much more useful for helping nerves heal and protecting them from further damage. Doctors usually recommend 300 to 600 mg of benfotiamine per day, either all at once or in 2 smaller doses. It works best when taken with food. Some people use it along with vitamin B6 and B12 because these also help the nervous system. Benfotiamine doesn't work instantly but builds up in the body. It often takes a few weeks to start working, and full benefits might take 2 to 3 months. It's not addictive and doesn't lose its effect over time. Most people don't get side effects, even at higher doses. Some report mild stomach upset or slight dizziness, but these are rare. Benfotiamine has been tested at doses over 1,000 mg per day in some studies with no serious problems. This makes it safe for long-term use, especially in people with diabetes who are trying to protect their nerves and organs. It's also useful for people taking metformin, a common diabetes medicine, because metformin can slowly lower B1 and B12 levels in the body. Taking benfotiamine with alpha-lipoic acid can help even more. Alpha-lipoic acid is another supplement that fights damage from high blood sugar. It helps repair damaged nerves and improves how cells use insulin. Together, benfotiamine and alpha-lipoic acid work on different parts of the damage caused by diabetes. This combo is often used in Germany and other parts of Europe as a standard treatment for diabetic neuropathy. If you want to try benfotiamine, look for a product that lists the exact amount per capsule, usually 150 mg or 300 mg. Brands like Doctor's Best, Life Extension, and Integrative Formulas are known for quality. It's best to take it every day at the same time and give it time to work. It won't fix everything overnight, but over weeks and months, it can protect your nerves and help reduce the pain and discomfort caused by diabetes. Methylcobalamin is the natural and active form of vitamin B12. Your body does not need to change it into another form before using it. This makes it more useful than the common form of B12, called cyanobalamin, which your body has to convert first. Some people, especially those with diabetes or genetic problems like the MTHFR mutation, have trouble making that conversion. When vitamin B12 is low, it affects your nerves, memory, energy, and even mood. This happens more often in people with diabetes, especially those who take metformin. Metformin is a medicine that can slowly lower vitamin B12 levels by affecting how it's absorbed in the stomach. Methylcobalamin helps your nerves in many ways. It is needed to repair the myelin sheath, which is a protective layer around nerves. This layer helps electrical signals travel quickly and smoothly. If the sheath is damaged, the signals slow down or stop, causing symptoms like tingling, burning, numbness, or sharp pain, usually in the hands and feet. This is known as peripheral neuropathy. In people with diabetes, this kind of nerve damage is common and can get worse over time if blood sugar stays high and B12 stays low. Methylcobalamin helps rebuild and maintain that nerve covering, which can improve nerve function and reduce symptoms. Doctors and researchers have used methylcobalamin in many studies. In one study, patients with diabetic neuropathy took 500 to 1,500 micrograms of methylcobalamin every day over several weeks. Many felt less pain and more feeling in their legs and feet. Some had improved nerve tests that showed their nerves were working faster. These are called nerve conduction studies. Another study gave patients 1,500 micrograms per day for 4 months. The results showed that patients had better balance and could walk longer without discomfort. Some could even feel light touches better, meaning their nerves were healing. Methylcobalamin also helps with red blood cell formation. Without enough B12, red blood cells get too big and don't work properly. This can cause fatigue and weakness. It also helps keep a chemical called homocysteine low. High homocysteine can damage blood vessels and increase the risk of heart problems. Methylcobalamin works together with folate and vitamin B6 to keep this chemical under control. In diabetes, where the blood vessels are already under stress from high blood sugar, this added protection can be important. This form of B12 is stored in the liver and used by the body as needed. It stays in the body longer than cyanobalamin. It is usually taken in doses from 1,000 to 5,000 micrograms per day, either in pills or lozenges that dissolve under the tongue. This under-the-tongue method is called sublingual. It works well, because it lets the vitamin enter the bloodstream without going through the stomach. This is useful for people with poor absorption or stomach problems. In some cases, especially if someone is very low in B12, doctors may give it by injection into the muscle, often once a week at first, then less often as levels go up. Methylcobalamin is very safe because it is water-soluble. The body will flush out what it doesn't use through urine. Some people may notice a pink or reddish color in their urine after taking high doses. This is normal and harmless. Side effects are rare. A few people might feel a bit more awake or get mild restlessness when they first start taking it. This usually goes away with time or by lowering the dose a little. Brands that make good quality methylcobalamin include Gero Formulas, Now Foods, Solgar, and Pure Encapsulations. Always check the label to make sure it says methylcobalamin and not just vitamin B12, since cheaper forms might use cyanobalamin. Methylcobalamin is often combined in supplements with L-methylfolate and vitamin B6 as P5P. These three work together in many body systems: nerves, brain, heart, and energy production. They are sometimes called methylation vitamins, and people who have issues with fatigue, nerve pain, or memory problems may benefit more when taking them together. People with diabetes who have numbness or tingling in their feet or who take metformin should ask their doctor to check their B12 levels. If levels are low or at the lower end of normal, taking methylcobalamin daily can help improve nerve health and may prevent more serious problems later. It's a simple and safe step that can make a big difference over time. Pyridoxal 5-phosphate, or P5P, is the ready-to-use form of vitamin B6. Normally, when you eat foods or take a basic B6 vitamin, pyridoxine, your body has to change it into P5P before it can be used. This change happens mostly in the liver, but in some people, especially those with diabetes, liver stress, kidney problems, or older age, this process may not work well. So, even if they're getting B6, it might not be helping enough. Taking P5P directly means the body doesn't have to change anything, it goes straight into the blood and starts working. P5P is needed in over 100 different enzyme reactions in the body. Many of these have to do with nerves, blood sugar, and making chemicals the brain needs to talk between cells. For the nerves, P5P helps make myelin, the protective layer that wraps around nerves like plastic on a wire. If this coating gets thin or damaged, nerve signals slow down or get mixed up. That's when people feel tingling, numbness, or pain in their hands and feet. This is common in people with diabetic neuropathy, where high blood sugar slowly damages the small nerves, especially in the lower legs and fingers. P5P helps make key neurotransmitters like serotonin, dopamine, and GABA. These control mood, sleep, calmness, and focus. If P5P is low, the brain can have trouble making enough of these, and people might feel more anxious, moody, tired, or unable to sleep deeply. It also helps with producing norepinephrine, which is needed for alertness and steady blood pressure. P5P also breaks down homocysteine, a byproduct from protein metabolism. Homocysteine is supposed to stay low. If it builds up, it becomes toxic to nerves and blood vessels. High homocysteine is linked to memory loss, blood clot risks, and faster nerve damage, especially in diabetics. P5P teams up with methylcobalamin B12 and L-methylfolate B9 to lower homocysteine safely. All three are needed in the body's methylation cycle, a system that helps with cell repair, detox, and brain function. In diabetes, pyridoxal phosphate levels tend to drop. High blood sugar may reduce the activity of the enzymes that convert regular B6 into P5P. Also, people with kidney issues may lose more B6 in urine. Low B6 has been linked to insulin resistance, where cells stop responding properly to insulin. This means blood sugar stays high longer, which causes more damage over time. Some small studies have shown that giving P5P can slightly improve how the body handles glucose, possibly by helping enzymes that work in sugar processing. In nerve-related conditions like carpal tunnel syndrome, which causes pain and weakness in the wrist and hand, P5P has been used with some success. In one older study, people who took 100 to 200 milligrams of P5P daily showed better grip strength and had less pain in their hands. These types of results matter to diabetics because they are more likely to get nerve compression problems in areas like the wrists and ankles due to long-term blood sugar effects on tissues. The most common dose of P5P is 25 to 50 milligrams per day. In more serious cases of deficiency or nerve damage, doctors might recommend 100 milligrams per day, sometimes split into 2 doses. It's usually taken with food to help absorption. P5P is safer than high doses of regular B6. Too much pyridoxine, the basic form, can build up in the body and actually cause nerve problems, especially if taken for many months in high doses. P5P doesn't seem to do this, even at higher doses, because the body uses it more efficiently and clears it better. Supplements that use P5P often include other active B vitamins, especially methyl B12 and methylfolate. These work together in nerve health, blood support, and detox. Some brands also add magnesium, which works with B6 in calming nerves and relaxing muscles. Good supplement makers like Thorne, Seeking Health, and Pure Encapsulations clearly label the form and amount of P5P on the bottle. It's important to make sure the label says pyridoxal 5-phosphate and not just vitamin B6, because that could mean the inactive pyridoxine form. People with diabetes who have tingling, burning, or tightness in their feet or wake up with numb hands may benefit from adding P5P to their routine. It doesn't work instantly, but over time, it can support healing and better nerve communication. If the person is also taking metformin, using P5P together with methylcobalamin and L-methylfolate can help fill in common vitamin gaps and support both nerve and energy health. L-methylfolate is the active form of folate, or vitamin B9. This is the version of folate that your body can use directly without having to change it into something else. When you take regular folic acid, the synthetic form of folate, your body has to convert it into L-methylfolate before it can do its job. But some people have trouble making this change, especially if they have certain gene mutations like the MTHFR mutation. For those people, taking L-methylfolate directly is much more effective. One of the most important jobs of L-methylfolate is to help lower homocysteine levels in the blood. Homocysteine is a substance that, if it builds up too much, can damage blood vessels, nerves, and even the brain. High homocysteine is linked to health problems like heart disease, stroke, and nerve damage. This is especially important for people with diabetes because diabetes can already cause damage to nerves and blood vessels. L-methylfolate helps break down homocysteine and keeps it at a safe level, which helps protect nerves and blood vessels. L-methylfolate is also crucial for making neurotransmitters, the chemicals that help nerve cells communicate with each other. These include serotonin, dopamine, and norepinephrine, which are important for mood, sleep, focus, and energy. Without enough L-methylfolate, the brain may struggle to make enough of these chemicals, leading to symptoms like depression, anxiety, tiredness, and poor memory. This is why L-methylfolate can be helpful for people who have mood or energy problems, especially if they also have low folate levels. Another important role of L-methylfolate is in DNA repair and cell division. It helps the body make new, healthy cells by supporting DNA processes. This is especially important for tissue growth and repair, including nerve tissue. When nerve cells are damaged by high blood sugar, L-methylfolate helps repair them and keeps them functioning better. It also works with other vitamins like B6, P5P, and B12 methylcobalamin in a process called methylation, which is essential for many body functions, including detoxification and inflammation control. In people with diabetic neuropathy, L-methylfolate is often used to support nerve healing. Diabetic neuropathy happens when high blood sugar damages small nerves, usually in the feet and hands, causing pain, tingling, and numbness. Studies have shown that a combination of L-methylfolate, B6, and B12 can help reduce pain and improve nerve function. In one study, people with diabetic neuropathy who took these B vitamins every day had less pain and better feeling in their feet. This combination of vitamins helps protect and repair the nerves, allowing them to work better over time. Blood sugar control is also improved with L-methylfolate. Studies have shown that people with diabetes who have low folate levels may have more difficulty managing their blood sugar. This is because L-methylfolate is involved in the way your body processes glucose sugar. When folate is low, your body may struggle with insulin resistance, which is when your cells don't respond to insulin properly. By taking L-methylfolate, some people can improve how their cells handle insulin, which can help lower blood sugar levels. The usual dose of L-methylfolate is between 400 micrograms and 1000 micrograms per day, though some people with low folate levels or certain conditions may take higher doses. Taking it with food can help your body absorb it better. L-methylfolate is generally considered safe, but like with any supplement, it's important not to take too much. High doses are usually only recommended for people with folate deficiency or those with genetic issues like MTHFR mutations. If you take too much, it may cause mild side effects like bloating, an upset stomach, or irritability, but this is rare. L-methylfolate is often found in B-complex supplements, which usually also include methylcobalamin, B12, and P5P, B6. These B vitamins work together in the body to support nerve health, improve energy, and help with metabolism. Taking them together can be especially helpful for people with diabetes who are dealing with nerve pain, fatigue, or memory issues. Some of the best brands for L-methylfolate include Thorne, Pure Encapsulations, and Seeking Health. These companies often sell L-methylfolate in combination with other active B vitamins to make the supplement more effective. When choosing a supplement, make sure it lists L-methylfolate on the label, as some cheaper folate forms like folic acid may not be as effective for people who have trouble converting it. If you have diabetes, taking L-methylfolate regularly can help support your nerve health, keep your homocysteine levels in check, and improve your blood sugar control over time. It's a safe and helpful option, especially for people with nerve damage or anyone who struggles with folate absorption due to genetic issues or other health conditions. Thanks for watching. I hope you learned something new about the vitamins that can support your health with diabetes. If you found this helpful, don't forget to like, comment, and subscribe for more tips on living your best, healthiest life. And if you have any questions or want to share your own experiences, drop a comment below. I'd love to hear from you.